Good evening to all of you, and welcome and thank you for joining us to celebrate one more day. 30 years empowering women, 30 days planning the future, a family, a dream, 30 years of launching a Mirena. My name is Marcelo Redondo, brand manager of contraception long term in Colombia, and I'll be joining you along with a great team to celebrate this anniversary as it is due. We've got guests from multiple countries, and to talk to you about that, I want to introduce my colleague Marina Araya, who is the brand manager for our company. Marine, welcome. Good evening, Marcela, and good evening to our guests and invitees. I'm joining you from Costa Rica, and today, being online allows us to have the presence of participants from multiple countries, from Guatemala to Peru. We've got an agenda which we will go through history with. Dr. Karen Delgado will share with us a summary of Bayern in anti-conception, and subsequently our special invitee Dr. Lopez will talk to us about how Mirena has improved reproductive health care of women. Chat will be active during the lecture. We are waiting for your comments and questions in order to be able to share them after the presentation of Dr. Lopez. So thank you for your participation. And Marce, we'll go back to studio. Well, thank you, Mai. And now it is the time to introduce Dr. Karen Delgado, medical manager of female healthcare for Colombia, who will talk about the role of Bayer in the modern contraceptives. Doctor, welcome. Good evening to all of you. It's an honor for me to be here with you, assisted by you, and joined by you in this important celebration in the 30 years of Mirena. We hope you enjoy this academic, interesting session, and of course, it is a great reason to remember how Mirena has been present throughout these 30 years in the lives of women. As we all know, throughout the years, Bayer, at that time Sherry, has been present not only for research but also with innovation in the lives of women. Since 1923, it started studies in sexual hormones. Then in 1960, it started with the first contraceptive pill. And then in 1968, Bayer introduced to the market the first contraceptive pill. And then in the following years, approximately up to 1967, Bayer started to support all strategy in the world on favor of women and facilitating the access to different choices of contraceptives. Of course, up to 1975, innovation arrived with the injectable contraception to generate a portfolio which later on, towards 1983, it's complemented precisely with methods as internal implants. And up to 1990, it was the time that nowadays we're celebrating, and it's the time in which, as the first time in the world, a intrauterine system is launched, Mirena. And so today we're celebrating those 30 years, but Mirena is not alone. It's part of a very comprehensive portfolio of female health products, which you know properly, among which we have oral contraceptives and injectable as Mesagin, Yadel, and intrauterine systems as Mirena, Yaides, Ikairina. And of course, it's worth highlighting or other choices of the healthcare, female health, as it is Dicen and Yane 35. These are all part of the history of Bayer with contraception. But nowadays, today we're celebrating the 30 years of Mirena. Mirena is the contraception choice which is adjusted to the needs of different women. It is a contraception method which is free of estrogens, which allows women contraception for up to 5 years. It's a method which is quickly reversible and generating great benefits for women, as it is the reduction of menstrual bleeding, a method which besides allows to use free estrogen-free contraception, giving fertility to women, and at the moment of being withdrawn whenever the woman actually needs it, without affecting breastfeeding and without having to be restricted by age or by number of children. Besides, the choice for all the ones that have had the chance of inserting this device is a very simple and practical device. What has happened throughout history with Mirena? It's millions of women in the world, the ones that have changed contraception to Mirena. And intrauterine contraception is gaining terrain step by step. Since 1990, since it was launched in Finland, up to now, in which we have it available in more than 120 countries. And every time taking more and more strength and power in the lives of women. Countries as Korea, who have up to 95% of use of intrauterine systems, and others as China, which are reaching up to 100% almost. And nowadays we're hoping our countries to join these great efforts for contraception systems, specifically Mirena, as high efficacy choice for women. Now we're celebrating today, we're celebrating Mirena, but we're celebrating specifically that women with different needs, even women, young women, adolescent women, women who are just starting their sexual lives, who are seeking for a contraception choice, or those who definitely decide not to become a mother. In all those cases, there is a choice as Mirena available for them. I hope we enjoy together this session, that it is a session of broad knowledge and learning, and of course, that we enjoy this next session with Dr. Glenna Rocio. Thank you, Dr. Carl, for reminding us how Bayer has had a strong impact in the empowering of women for almost 60 years. As we saw, Mirena is one of those great gifts that research and development of Bayer has given to society. And to deep dive in this subject, I want to introduce Dr. Arnaldo Lopes da Silva. He is a gynecologist and oncologist, president of Brazilian Association of Gynecology, and title holder professor of Minas Gerais University. Dr. Lopez, thank you for accepting our invitation. It's a pleasure having you with us, and welcome. Good evening, Marcela. I would like to thank the invitation for the event Mirena 30 years, empowering women at this time with such important changes in our lives. It's a great pleasure to be again with colleagues and friends from Central America, Colombia, and Ecuador. Special thanks to Carl Delgado and Pilar. It's an honor to share with you the story of a product, Mirena, which had such an important impact in the lives of women in the world. We are celebrating the 30 years of Mirena. Throughout the years, great advances have been achieved towards the improvement of sexual and reproductive health of women. The introduction of the first oral contraception pill in 1960 as a movement to put women in control of their sexual and reproductive health. Through the use of contraception effective methods. Reversible contraception of long-lasting action or long-acting are reversible actions that are highly effective long-term and which are profitable or cost-effective. Even implants, injections, and intrauterine devices, hormonal and non-hormonal. Contraception or intrauterine contraception is used by 160 million women in all the world. Almost a 20% of all the users of contraception. Non-planned pregnancies represent a great healthcare problem in the whole world. In Latin America, a 56% of pregnancies are unintended, and there is a very tight relationship between unintended pregnancies with mother or maternal mortality. So it's 30 years of history of Mirena, which takes us to this presentation since its launching in 1990. We've got more than 110 million years of experience in its usage, and it's more than 6,000 publications in more than 20 different regions in all the world. Mirena is an intrauterine system which offers contraception for 5 years and also is indicated for the treatment of abundant menstrual bleeding in those women that receive therapy of hormone replacement. Certainly very familiar for all of you. Mirena generates local effects in the uterine cavity. This is its main mechanism for its contraception. The story of Mirena is important in innovative research and development, which changed throughout the time and have given shape to the landscape of health of women as we know it right now. We're going to see the timeline where we have the main studies that were dedicated to the development of Mirena. We'll discuss the different key moments and we will show you where we are today. The intrauterine devices, conventional and classic devices here have been in the market for some time. However, these devices were not popular and some of them did not have undesirable side effects, exception for the inflammatory normal consequences. It was possible thanks to several developments. First of all, it improved the understanding of the effect of steroid hormones. Bayer was very engaged in this characterization of progesterone since 1923. It was demonstrated in the efficacy of the dose, low progestin, and different systems were developed and tested. Testing methods of sensitive hormones available, and it was also found that the addiction of progestin to plastic devices reduces the probability of any diseases. It was possible the sustained release dosing, as we know it right now. The early development of the hormonal intrauterine system was possible thanks to the introduction of this option of empowering a sensitive and precise system to evaluate the concentration of gonadotropins, and steroids, and besides, different materials were developed as the polydimethylsiloxane, which had pharmacological properties for a long time. The first IUS that has sustained progesterones was tested in monkeys with promising results. However, and with no systemic effects, it had an impact in the ovarian function. During the 70s, small studies were developed with intrauterine systems with progesterone contents in Finland. They included low rates of pregnancies, reduction of bleeding, and low side effects. However, as the first designs of uteral frames, the dissemination rates were high. Then in 1977, there was a pilot study done in releases of levonorgestrel, including it in all medications in the frame of these devices, and it demonstrated a constant release of levonorgestrel in the intrauterine cavity, suppression or uniform suppression or menstrual suppression, and favorable results. In 1989, the need of research actually took us to a study. They informed us about pregnancies with the intrauterine system releasing of levonorgestrel. It was efficient at an international level, which actually took 5 years, which demonstrated accumulated pregnancy rates of 5 years of 1.1% of Mirena, compared to 1.4% for intrauterine devices of copper. A European study in different centers with collaborators demonstrated a accumulated pregnancy rates of 5 years and 0.5% of Mirena and 5.9% for the CU or copper IUD. Mirena offers a choice and which actually lasts for 5 years of contraception, which is associated with the decrease of the amount of bleeding. Mirena has a favorable bleeding profile. The loss of menstrual bleeding decreases progressively with the usage of Mirena, which actually turns out to have shorter periods. Mirena is an appropriate contraception for most women, independently on their age or parity. In the past, it was believed that intrauterine devices could not be appropriate for young women or non-mother women. And now studies have demonstrated that Mirena is indicated for these groups of women, or nulliparous women. Mirena is associated with high rates of satisfaction and continuation. 95% of users of Mirena inform or report that they're satisfied or very satisfied. The appropriate counseling increase the rates of satisfaction in the use of Mirena, and this is an important point of Mirena. In all contraceptions, it's necessary to have an appropriate counseling. Mirena contributes to reduce the abortion rates. The introduction of Mirena was related to the higher use of reversible long-acting contraception systems and therefore to prevent abortions. And besides, the recent study has demonstrated that including Mirena as part of the process post-abortion can reduce the probability of subsequent abortions. Since the introduction of Mirena, there has been subsequent reductions or decreases in the amount of procedures or surgical procedures in different patients by offering an effective treatment to the abundant or HMB, and it has been reduced on time. Another way in which the clinical practice has changed is through the introduction of just one hand or through one hand. Is more ergonomical, more is safer, and making possible more comfortable insertions for women. Profitability of Mirena is high in 5 years, not only in terms of cost of medical care, but also in terms of cost for the patient. It's the less expensive contraception choice and it's also the most profitable. Indeed, research which investigated the profitability of Mirena was one of the first in also analyzing the impact of unintended pregnancies and the heavy menstrual bleeding in the patients. For example, considering also in terms of painkillers, health protection, and the absence from work. What is expected for the future? For the coming years of Mirena, the extended use, the efficiency and safety of Mirena has been researched to be used for up to 8 years, and the degrees of efficacy and safety in the real world. Digital innovation for development of digital tools to support professionals and in charge of health of women. Now, me as a researcher, we're working on an article in the development of an application with artificial intelligence to foresee the bleeding pattern after the insertion of different intrauterine systems. And also we're going to continue taking advantage and exploring how to improve the intrauterine system. Mirena is an appropriate choice in different stages of productive life of women, and it may offer a set of benefits which goes beyond the contraception. The use of reversible or long-acting contraceptive have increased in the whole world since the introduction of Mirena in 1990. Mirena provides highly effective contraception for up to 5 years It's a high rate of acceptance, but due to the need of women beyond contraception, we work in supporting them. And one of those needs is a good control of food at the moment of a heavy menstrual bleeding. It's a problem that affects 1 out of 3 women in the world, and it has an important negative impact on the quality of life of women. We did a research to assess the journey of women who suffer heavy menstrual bleeding. Women from 18 to 80 to 49 years in Brazil, France, Russia were invited by email or through email to participate in this study. Many women with heavy menstrual bleeding suffer in silence, even though they think they need help. 40% had never seen a healthcare professional during their heavy periods. The time of those first symptoms up to doctor's appointments was in less than 2.7 or in almost 3 years since the beginning of the symptoms up to a doctor's appointment or a doctor's visit. The journey of women with a heavy bleeding indicate a great part of suffering, a delay in the diagnosis, and a gap in the access to the therapy. Heavy menstrual bleeding affect women at a social as well as at a medical level. The heavy menstrual bleeding have severe impacts in the lives of women, avoiding them from planning the social activities due to the bleeding, missing work, or even staying trapped in bed because of the pain and the abundant bleeding. This is a very important data. Only 20% of women were diagnosed and having received an appropriate treatment in some moments of their lives. Therefore, it is necessary to improve a lot the awareness and the access to the appropriate therapy for that heavy menstrual bleeding, because most affected women stay with no treatments. Heavy menstrual bleeding may have a pathological cause, but in most women, there's no pathologies that actually explain the heavy bleeding. The International Association of Gynecology gave a value to a system, giving a classification PALM in this acronym PALM COAIN. This system separates the causes of heavy menstrual bleeding in women in reproductive ages in categories structural and non-structural. PALM gives a classification referring to different structural myomas and different tissues which could be modified or worked on with a therapy. And the COAIN side is the non-structural causes, the ovulation, the endometrial causes, the different causes that have no classification. So with COAIN, it is possible to have a consideration of medical disorders that could actually give as a result the abundant or the heavy menstrual bleeding. We know now that most women have non-structural causes or structural minimum causes of the bleeding. So the medication treatment is a good choice for most women with heavy menstrual bleeding. Mirena is recommended as a choice of treatment of first line for the heavy menstrual bleeding in multiple guidelines in several countries. ECOG, FIGO, BRAS, many countries, several guidelines from different countries put Mirena as the first line of treatment of heavy menstrual bleeding. Why? Because Mirena meaningfully decreases the loss of menstrual bleeding since only 3 months after the placement. It represents a decrease of up to 96% in the loss of blood in the menstruation. Now, this blood loss, Mirena associates itself with higher levels of hemoglobin in women with abundant or heavy menstrual bleeding. Once again, counseling is important for the management of heavy menstrual bleeding. We need to take into consideration several aspects. HELP is a group of physicians from different countries who actually study the heavy menstrual bleeding. There are some guidelines for the treatment of that heavy menstrual bleeding given or issued by this group of physicians. Mirena is an effective treatment to endometrial affection or discomfort, and for the treatment of abundant bleeding or heavy menstrual bleeding, which can be used in younger women where they can preserve the uterus. But the knowledge of heavy menstrual bleeding continues to be a great problem. 50% of women have little to nothing of knowledge of heavy menstrual bleeding, and around 40% of women do not know that there is a treatment available. Mirena also takes care of the needs of women in the transition of menopause with treatment and hormonal therapy. Mirena is proven for this indication. The benefits of a bleeding, the benefits with contraceptions, we know that the transition of menopause could be associated with abundant bleeding, and there could be some disorders. And because of the favorable security profile and also the decrease of the bleeding or ovulation symptoms, and the main one beyond conception, how Mirena can empower women in different stages of their lives. Women now play an important role in society. So a lighter bleeding with less hemorrhage is very important for women. Mirena is discreet. It has no need of additional adherence, and it provides a highly effective contraception and highly reversible and during the whole fertility period. And here a great differentiator of Mirena, a very effective treatment for the heavy menstrual bleeding. Mirena can also help change the landscape of medical health or medical health care of women. It could increase the productivity and participation of women with the decrease of abundant bleeding, which can actually mean that more women can participate fully at work in their daily activities. It can help a lot of women, and Mirena is a green contraception. There's a decrease of a quantity of health protection envelopes and other products. The role of women in society. Mirena is very interesting and is very focused into these aspects. So after going through the 30 years of Mirena, we can conclude Mirena has a reduction in the amount of labeling and medications, and in regards, after going through the 30 years of Mirena, we conclude the profitability of Mirena is high in 5 years, not only in terms of medical cost, but also in terms of cost for the patients. Mirena can be placed directly or right after an abortion, and it is highly effective to reduce the probability of subsequent abortions. Mirena improves the reproductive health for women in all groups of ages or at a reproductive period, and empowering women that way. Mirena is extremely effective for the menstruation symptoms as menstrual pain and heavy menstrual or menstrual bleeding, to reduce or by reducing the bleeding as well as the production of or the release of hemoglobin, and it increases the quality of life of women. Mirena can be considered as a milestone and as a great progress in the health of women. its effects go beyond contraception. Congratulations to Bayer and congratulations to Mirena for its 30 years. And thank you for your attention. Thanks, Doctor, for this great presentation and for reminding us that Mirena continues to be a modern contraceptive, which for 30 years have empowered women in the pursuit of their dreams. We received several questions and comments for Dr. Lopez. In order to start this discussion, I want to give the floor to Dr. Pilar Robles, who is a medical manager of medical health, who will be moderating this session. Welcome, Dr. Pilar. Good night. Good evening. Good evening. Thanks, Marcia, for this opportunity. I'm glad to be for being celebrating here the 30 years of Mirena. We want to remind you that we have the chat open so that please you can write your questions and Dr. Lopez is eager to answer. We've got some of them. Welcome, Dr. Renando. So we're going to start with the first one. They're asking us about Mirena in the use of pre-menopause. For how long can we leave the therapy? Can we leave the therapy in place, and how long is it recommended after the menopause? Thank you. It's a very important question. Now in Brazil, we had the launching of Cagina and Bayer and indications that Mirena has for contraception, Mirena for heavy menstrual bleeding, and also as a possibility for the post-menopause hormonal therapy. We think it is more prudent to keep the same indication of Mirena for 5 years. Now we have new studies assessing the endometrial protection of Mirena, but we keep the indication of 5 years for Mirena also in post-menopause. Perfect. Thank you very much, doctor. Now we have another question. This question comes from Colombia. They're asking us the following question. What to do with patients with spotting at the 3rd or 4 years of Mirena who do not respond to the handling of oral contraception? Yes, the bleeding after any method has only progesterone. It's a great problem. Now with Global Bayer, we have a scientist, or we're working with a scientist, and we're going to publish this article, which is going to be an application to assess through artificial intelligence the bleeding profile after the insertion of all intrauterine system as levonorgestrel, and it is something that's very important. We have a study of the remission of Cochrane, and this study showed or did not show any drug with a great effectiveness in these cases. We can try the use of anti-inflammatories or non-steroid anti-inflammatories. That's a possibility. The possibility of the use of antifumolytic drugs is another possibility, and also the possibility of using an oral combined contraception for a period of time. That's a possibility. And also we have some data in regards to the possibility of antibiotic, doxycycline. The objective of using this antibiotic is not for an eventual treatment, but a stabilization of extracellular matrix. And the great problem that we have is we do not know if the effect is because of the use of these medications for a decrease of bleeding, or if it is time. We know that it is way more common to have a bleeding or spotting, a escape bleeding in the first years of a use of Mirena. It's not a question, which is a bleeding with longer time. It's very important. If there is a change in the pattern of bleeding, we need to come up with imaging methods to see if there is something else. For instance, vaginal ultrasound, also flushing of the uterine cervix, but the possibility of a spotting bleeding is for a short time span, the possibility of a combined oral option for a cycle or an antibiotic, which is a possibility. But it is very difficult, the management of this bleeding. Thanks, doctor. Another question is about androgenization, which is a disorder, and how we can use Mirena in these cases. I think Mirena is a choice, is a very good contraception choice, and it was a great progress in the health of women in all the world from the point of view of contraception, from the point of view of the decrease of side effects, and the heavy menstrual bleeding changed a lot. Now, in the surgical management for heavy menstrual bleeding, with the use of Mirena, have decreased a lot the surgical treatments. So Mirena has not only an contraception, which is very safe and efficient, but also with a lot of benefits that are non-contraceptive. Now we have the hyperandrogenic symptoms in women. We know that contraception pills block the hypothalamus and the ovaries. It's not the case of Mirena. So I think when we have a woman with hyperandrogenic symptoms in the skin, hyperandrogenism, and estrotism, we have other very good choices. For instance, the combination of cyproterone with maybe another antibiotic, but it's a possibility for those women who are using Mirena, is the combination of a medication or anti-androgenic medication, for example, scrolactone or leciproterone in these cases. So it is a very interesting possibility. And because we do not know if a problem with hyperandrogenism is associated with Mirena, or the change of a woman, for instance, if she is taking a contraception pill, and if she has an important anti-androgenic activity, with time there can be a worsening of the skin of women. Thank you, doctor. We have a very good question around here. Dr. Mirena, she's asking us, she's got a patient who's got 5.5 years with Mirena, and with the COVID situation, she hasn't been able to change it. She's asking for how long the patient can have it. We keep the indications of Bayer for Mirena. Mirena duration up to now is 5 years. But we already have some research with the evaluation of the use of Mirena showing an effectiveness that's very high, up to 7 years of use. But we keep the indications of Bayer for 5 years up to now. So in a situation, an exceptional situation, as it is the case of the pandemic of COVID-19, the possibility of postponing, putting off the removal, the change of the Mirena is possible with a lot of security. This is a possibility. Yes, thank you. I've got a mix of questions. They are asking us on the role of Mirena in endometriosis, and they're on the other hand, they're asking if during the endometriosis, Bisanya can be given as complement. Mirena has a more local action, but we already have a lot of studies of Mirena in endometriosis. It is an important decrease. Is a light slight pain. So I don't have the I'm not the habituality of the two hormones, Mirena and Denopes. For me, for the cases of endometriosis, which are more severe, in those more serious cases, women who have a lot of symptoms, Diana gel is an interesting possibility for endometriosis. But for the lighter cases in which there is a good control of the cycle and of pain, I keep the Mirena. The combination, I don't see it as a choice long term. Yes, it could be a choice short term to see the effectiveness and the improvement of symptoms. Thank you, doctor. Dr. Ernesto Posada is asking us, what is the current handling of a patient with this contraception who has polycystic ovaries? As I was saying, I apologize for my Portuñol, for my Portuguese Spanish mixture. I've been in Colombia and Ecuador, but I'm trying to speak a mixture between Portuguese and Spanish. But as I said, Mirena is a very good choice for contraception, for heavy menstrual bleeding. But the problem of Mirena in the cases of polycystic ovaries, when we're thinking of hyperandrogenic symptoms, could not be the best choice. In these cases, a combination, again, of ethylpredil and with cyproterone could be a good choice. There are robust studies that show a large efficacy, all hyperandrogenic symptoms. On the other hand, Mirena has a very interesting action in the syndrome of polycystic ovaries, the endometrial protection. We know that the polycystic ovaries are a metabolic disease and systemic disease which has several different statements or expressions. We have the metabolic effects, so it is something important, and also the possibility of an endometrial hyperplasia and likewise an endometrial cancer. Mirena has the endometrial protection in these patients. One more aspect for contraception is that we must always take into consideration the eligibility criteria of the WHO. So some patients with polycystic ovaries have contraindications to contraception or hormonal combined contraception orally. So in these cases, Mirena is a very good choice because there is an association of Mirena with a higher risk of thromboembolic phenomena. So it'll be in these cases, but for cutaneous or skin expressions in the skin, Mirena could not be the best choice. We have the possibility of an association with other drugs. Mirena plus, for instance, cyproterone or pyrrolactone in these cases. Perfect, doctor. One more question. They're asking us, what happens to those patients that are anxious, who in general believe that all contraceptions or hormonal methods will harm them or worsen them? Are there any contraindication studies in these kinds of patients? Yes, right now in Brazil, we have that problem, and it's something that's a global concern, the concern with hormones. In the case of Mirena, we have, it's more calm, but because there are no estrogens, so the possibility of using only progestogenic, we don't have anything that has to do with embolic problems or with these other kinds of side effects. The possibility of Mirena right now reaching 30 years of history is something very strong on how we have seen. We have more than 6,000 postings or publishings with Mirena, pretty much all countries in the world. So we have very strong evidence showing an optimum safety profile and efficacy profile of Mirena. So I believe the largest importance is in the counseling. How do you say in Spanish? Counseling of patients. I think when we have the possibility of talking and of showing the evidence of Mirena, I think it's the best way of changing this belief that women may have a higher risk. Nowadays, I think Mirena changed the whole history of the female health, and nowadays we have a lot of evidence to assure that safety profile for women. And I think counseling is the most important thing of all aspects. Thank you, doctor. They're also asking us about the septum, the uterus septum, if Mirena can be used in patients with septal uterus. When we think of Mirena, and as you said, or as I said, every time we need to take into consideration the usability criteria given by the WHO. We have very few contraindications to Mirena. Criteria categories 3 and 4 of eligibility criteria given by the WHO. And one of them is uterine malformations. In this case, it is a contraindication. Those septal uterus are a contraindication to the use not only of Mirena, but for all the intrauterine devices. Continue. Questions are going on and on. Doctor, one more question. I got patients from Central America who has a patient with Mirena who has polycystical ovaries. It usually happens. Once again, counseling is important because we know when there is a comparison of Mirena with Kalina, the rates of ovary cysts or size is higher in Mirena compared to Kalina. It's a reduction of 20%. We know that we have several research or studies assessing the ovary cysts, is that most women do not have symptoms and do not require a specific treatment. The behavior is only expectational in these cysts, and it's something that may happen, but in most women there isn't a most important clinical meaning. Only leaving women alone at some point and not doing surgery, just an ultrasound, transvaginal ultrasound control in these women. Perfect, doctor. We have another question. We'd like to know if, when having a patient with a simple major mass of 5 millimeters with Mirena, you would withdraw it. Dr. Posada is asking from Bogota. We need to take into consideration other aspects. If there are symptoms associated to the mass, a cutting point is difficult. 5 centimeters, not millimeters, 5 centimeters is just halfway. I would have the possibility, if it is a woman with no symptoms, there is no. We are not thinking on the possibility of a removal of the mass or an ovarian removal with this initial mass. My behavior would be only an expectational behavior in these women, and with a control with imaging methods for these women. So if it is a woman with no symptoms, I'm not thinking on the possibility of a removal. I would keep a clinical control in these patients with transvaginal ultrasound. On the other hand, if there is a woman with a lot of symptoms and to whom there's a possibility of doing a removal, I could think of a surgery, a laparoscopy for this woman. Laparoscopy. We'll continue with the chat. We have one more question. This question is about acne. Theoretically, it shouldn't go for more than 3 months, that's what they said. In some part of population, are there any comments in this? Yes, there are some studies that compare the contraception pills with um, levonorgestrel. There are some comments, and also pills only with levonorgestrel with continued use, and the intrauterine systems with releasing of levonorgestrels. The levels of levonorgestrel are very low. All non-oral presentations are associated to a very low level of levonorgestrel. So there is very levonorgestrel circulating in women. In the intrauterine system, it's even lower. But we have seen in the day-to-day practice that the first 3 months could show a symptom of this circulating levonorgestrel, for example, acne or some kind of headache, all kinds of issues like this, or symptoms like this. And the great doubt is exactly what I said before, the issue of the possibility of women of using, for instance, an anti-androgenic activity. So the levels of are very low, and the trend that of acquiring these symptoms are more frequent in the first 3 months. The trend, the symptoms are going to happen, a decrease of symptoms in the following months. Perfect. They're asking us, Dr. Joaquin Castillo, if there is a patient with an endometrial cavity of 25 millimeters of wide or width, will you put Mirena? We stay ourselves with the possibility of other levonorgestrel releasing systems. The questioning in regards to the size of a uterus for releasing systems, the pattern is 60 millimeters. Hysterometry or hysterometry, it's the measure of 60 millimeters. But now with the studies that we saw, it's very rare that a woman with who have a hysterometry lower than 60 millimeters, it's very rare we stay ourselves in that point. A hysterometry more than 60 millimeters, women can use Mirena or any other kind of levonorgestrel releasing system. We're going to ask a couple more questions. This is regarding Mirena in adolescence or in adolescence. They're asking from Panama, a 17-year-old patient with no intake. Is it advisable to use Mirena? Yes, it is advisable. That's the question. It is advisable, and it is a recommendation. It is a very good indication for Mirena for all ages. Reversible contraception or long-acting reversible contraceptions, we know that young women, even women who haven't had any intake, have a larger risk of pregnancy. So Mirena is indicated for young women and that haven't had any children. It's an important way using intrauterine devices in these women. We need to insist in its use because they benefit a lot from the use of Mirena. We have a very strong recommendation or very strong recommendations from American College of Gynecology, the Association of Gynecology recommend the usage of Mirena in adolescents too. Okay, we're gonna go with the last question. For audience, do not worry, we're gonna try to answer questions through other methods, through other channels that are called medical information to answer all your questions. This one comes from Medellin, Colombia, and it is asking if we can trust in the reviews done by the IUS under laparoscopy, or if it is recommended to be done with a transvaginal examination, even though there aren't any changes in the length of a cavity. In Brazil, we now are going to publish a study with Professor Bahamut. For the study, we did a survey with 20 people who have broad experience, long experience with Mirena in Brazil. We're going to publish right now, and it's just information. We do not have very strong scientific evidence, for instance, on when we should release the woman after an insertion to continue relationships, physical activity, and else. And one of the questions in regards to the control and positioning of Mirena is 20 different managements. 20, if it's 20 people, it's 20 different handlings. So it is important to use the, how do we use the few in Spanish? The few, how do you call it in Spanish? Of Mirena. This, the cycles, is it possible to assess the cycles? But in my clinical practice, the echo for me is important, or EKG. It's important that EKG is actually done after 4 weeks, because these problems are more common after 4 weeks. Perfect. Well, thank you very much, doctor. Really, and thanks the audience in general, because you were very active. Thank you for your questions. Thank you, doctor, for your presentation. And we're going to go with Miley. We're going to give the floor to Miley. Thank you very much. Thanks, Pilar. Thank you for your questions and comments. These kinds of activities get more sense, or make more sense, thanks to your interest and your active participation. Well, Marcela, we're closing this celebration now. Yes, for Bayer, it has been a pleasure to share this time with you. Thank you for being part of this great family and for making Mirena the most used intrauterine system global wide. Let's continue to work as a team for the health of women. Have a great night.